Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Health Department assures the public there is nothing to worry about, even as cases of respiratory illness among children surge in northern China. Filipinos can expect a more accessible cancer care as the Philippines opens its first specialty hospital to diagnose and treat cancer patients. Health Undersecretary Eric Tayag joins us in the program. And beat the rush by jump-starting your Christmas shopping at a 4-day holiday fair opening today. Artefino co-founder Mel Francisco and fashion designer Rosana Ocampo tells us more later in the show. There is a growing global concern over the surge in the number of children with respiratory illnesses, including pneumonia in China. Here in the Philippines, the Health Department says it is closely coordinating with the Chinese government and the World Health Organization. It adds the department is ready if flu-like cases increase in the country. The department also notes the WHO has not yet recommended stricter border controls despite the situation in China. Let's go straight to the source of the story. We have Health Undersecretary Eric Tayag. Usec Tayag, welcome to the source, sir. Thank you so much for your time.
Good morning, Pinky.
Good morning, sir. So first, I want to ask you, number one, why are there so many people getting sick nowadays?
Okay, the Department of Health has been monitoring influenza-like illness, wherein a patient can present with fever, combined with sore throat or cough or colds. Since the start of the year, the number of cases has increased. In fact, it's 50% higher than last year. Now in China...
Sorry, Usec, did you say 50 or 15?
50.
Okay.
That's 50%, Pinky. We are close to 200,000 cases this year here in the Philippines. Now, we try to confirm if we get samples from these patients. Most of them will have influenza A or B viruses. The others will be tested positive for COVID.
So
in China,
okay.
In China,
go ahead.
They have relaxed their restrictions in December, and the way they're explaining this now, and also can hold through for the Philippines, is that those who were under strict restriction would have not developed enough immunity against other viruses or pathogens. That's why when the restrictions were relaxed and children went back to school, then we see a number of cases from other pathogens other than COVID.
Got it. But we have the seasonal flu shot, don't we? Will the seasonal flu shot cover whether it be influenza A or influenza B virus?
It covers influenza A, influenza B, except, Pinky, that we used to give this only to senior citizens. Unlike in other countries wherein children are given influenza vaccines.
Okay, so when doesn't the WHO come up with the influenza shot yearly, or is this twice a year?
It's given every year. That's because they have to change the formulation because the particular circulating strain is being monitored. In fact, we send samples to collaborating centers of the World Health Organization as our contribution in the production of these influenza vaccines every year.
Right. And basically what it is, no, Dr. Tayag, is that they determine which virus, I guess, would be the prevalent one.
Except that in China, they have reported that there's another bacteria causing this respiratory illness in children. It's Mycoplasma pneumoniae. We have the capacity to confirm this if it's really Mycoplasma pneumoniae. But then again, we just got news that aside from China, Netherlands has reported also similar cases in that country.
Hold on. Just to be clear about this, Dr. Tayag, this Mycoplasma pneumoniae, that is different from the usual influenza A and influenza B virus.
Yes,
Yes,
this is
because
not a virus. This is a
bacteria.
and antibiotics can work, except that in China, there's a high drug resistance rate for mycoplasma.
And is that because of what you explained earlier? Why there's
Because
a
of the
high
because of the
resistance?
nature, yeah, because of the nature of mycoplasma pneumoniae, it doesn't have a cell wall, and most antibiotics work against the bacteria because of the cell wall. And mycoplasma doesn't have this, and it easily incorporates to our cells. That's why even after treatment, they linger around for weeks. Patients may have cough that persists for weeks. That's the mycoplasma pneumonia. It's also called the walking pneumonia because even if you have pneumonia on chest X-ray, you continue to feel well, not so bad, except that a few may be hospitalized with complications.
In fact, I'd like to share that I have had people quite close to me who've had this flu-like system, not treated though, but it lasted for, it was a really bad cough and lasted for even more than 2 weeks. Would these be the symptoms of this walking pneumonia or this mycoplasma pneumoniae?
I think it's possible because in many surveys involving these pathogens, 40% of those who catch a community-acquired pneumonia, would be secondary to mycoplasma pneumoniae.
All right, we lost Undersecretary Tayag there on the line. We're going to try to get him back on air as we talk about why so many people right now are actually getting the flu. And the problem is there's been a reinfection, even among children. We're going to talk about that after the break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, Health Undersecretary Eric Tayag. Usec Tayag, so to summarize, what I want to find out is this mycoplasma pneumoniae, is that already, has that been recorded here in the country?
That has been recorded in the country, except that today or even years of, in the past, this is not a regular pathogen that physicians would actually
look for,
request from the laboratory or look for.
Yeah.
If they suspect it, they already give the antibiotic suited for it.
Yeah. How contagious is this?
It's so contagious that even before symptoms appear, like cough, one who's infected can already transmit it to another person via close contact.
From what I'm trying to recall now from the past, hindi ho ba the virus is the more contagious one? Kasi tama ho ba because it's airborne unlike a bacteria?
This is also a pathogen or a microbe that can be spread or transmitted through respiratory means.
So can one actually find out that you're positive for this mycoplasma pneumoniae?
Yes, there's a test after a swab, just like for COVID-19, except that only a few laboratories can actually do this.
And if you're positive, for example, are you supposed to isolate yourself?
Yes, that's a common sense protection for others who live in the same household.
And
so mycoplasma pneumonia can be prevalent in closed settings like schools, prisons,
yeah.
households.
So it behaves like COVID?
It is, except that it has the label of walking pneumonia.
Yeah.
Walking pneumonia because you feel all right, except for COVID, it can easily progress to something that's terrible.
Yeah, that's true. Usec, what about the possibility of reinfection? I've seen some people who get sick. I don't know if this is just a regular flu, influenza, or this mycoplasma, but there's been a lot of people that's been reinfected after 5 or 7 days.
Mycoplasma is notorious for reinfection. In fact, even after treatment, it can linger for weeks, and that's when patients who are infected with this bacteria would complain of a cough
Right.
that has been with them for even 4 or more weeks.
Yeah. So, will antibiotics work?
Antibiotics work except for children that's in A. So it's a big concern if younger children are affected. And we're now checking the resistance rate for these antibiotics against mycoplasma because
Okay.
it can be a concern.
All right. And just shifting topics, how is the COVID situation now in the country, sir?
We are still reporting COVID cases. There has been no update for COVID cases in ICUs. That's a good sign. And we have people still going for testing if they suspect if they have COVID. And that's a good sign too.
All right, and I just want to bring this up, sir, because the president recently inaugurated the country's first cancer hospital. Excuse me, last week. It's called the Healthway Cancer Care Hospital. Again, it's located in Taguig City. I guess tell us about how this can help. Well, number one, accessibility in terms of accessibility and financial considerations for those suffering or who are inflicted with cancer.
Pinky, number one, cancer is now the second leading cause of death. Number two, the Department of Health spends billions so that we can provide necessary cancer treatment either through PhilHealth or through our cancer treatment program. It will help so many, except that now what the Department of Health has planned is to have several cancer centers in many of our third-level hospitals.
Right.
So that we can meet the demand as fast as we can.
You know, the president, when he gave the speech, no, when this was inaugurated, I think he said it was the third killer in the Philippines, and you're saying this is the second one?
Yes, it is. It's the second one
Okay.
following heart diseases.
All right.
And
Health Undersecretary Eric Tayag, sir, pleasure to have you. Thank you so much for your time.
thank you.
And when we return, we're going to talk about over 100 thoughtfully curated local brands come together for Artefino's 4-day fair ahead of the holiday season. We'll speak to Artefino co-founder Mel Francisco and fashion designer Rosano Ocampo in just a bit. We'll be right back.